Weight has always been an issue for everyone in my family, but it wasn't like it was impeding my health. When I got to my 20s was when I started to actually feel it, my knees, but by that time I was already well over 500 pounds. So I decided to have gastric bypass surgery, and it worked. I lost 300 and some odd pounds, and I felt great. After I had that initial surgery, there was some skin removal surgeries and things like that. After everything was done, I noticed that I had a lot of extra skin on my legs that wasn't really going away. No matter how much I worked out, it wasn't tightening up. So about 10 years ago, I started having some vascular issues where I was getting, they thought I had a blood clot, and they sent me for vascular workup. And I went to that vascular doctor. He's the one that had told me about Dr. Singh. But I didn't do anything at that point, and I just worked around it. You know, when I take the kids to the zoo, it's like, okay, give mommy a few minutes. I got to sit on the bench and recoup, and then I'll meet you. So 3 years ago, I finally worked up enough nerve after repeated cellulitis infections, skin discoloration, skin pitting, very bad rashes where I needed to take bacterial medication. My legs were swelling, so I went to see Dr. Singh.
So Ms. Ortiz is a patient that was very debilitated by what's called lymphedema. She had this large mass on one side of the leg and a second mass which was not as big on the other side of her leg. The mass was so big that she had difficulty walking, difficulty doing daily activities, and it continued to get larger and larger to the point that she pretty much became bedridden. Patients suffer from either lymphedema or what's called lipedema. Lymphedema is an accumulation of fluid, and lipedema is accumulation of fat. Linda had a combination of the two.
He explained the whole procedure to me, and when he first examined me, he looked at me and he said, "Oh, I can definitely help you."
So Linda underwent what we call a radical debulking surgery, and that's a rare surgery that's performed in not many centers in the United States, where we essentially just excise out the entire mass along with the tissue that's underneath it, and sometimes what's called fascia, which is something even deeper down that holds all the muscle together. The
first leg was over 15 pounds of tissue and skin that was taken out. And the latest surgery was over 11 pounds.
The most gratifying part of this procedure is seeing patients return back to their normal lives.
Dr. Singh and his team were amazing. I'm able to move around, I can go up and down the stairs, I can cook, I can walk, I can work, so it's much better.